Now this session onwards, it's on tracker, or what we say granular data. But it's simple, but like you just have to know where to go, how to set. Yeah. Today's objective is this one. So you should be able to create a case-based program. I'll explain what is that one. A event registration, able to track an individual across their health program, analyze the granular data, generate the schedule, and able to aggregate the data from granular data. That's all. That's the objective for today. Okay? So create your programs, 3 programs, analyze your granular data, and generate schedules, visit schedules and other things, and then aggregate the data from the granular so that like you can get your all the HMIS report. Yeah? Fine, that's the one. Mute. Yeah. You know, like we used to what DHS tracker. After 3-4 years, like we found this name tracker. Before it was called name-based, case-based information system and everything, but now it called it as tracker. It's just a module inside DHIS. It's not, there is nothing called tracker in your DHIS, but just a concept, what we try to put it. But we are still searching for the good name. So let's see. So we need to, like as Arthur mentioned, like the bottom line is the community where we collect the data. Like in every health facility, we have a household register, right? Household register, delivery register, ANC register, immunization register. So all these register, you have the names, and then you enter when the dose was given, when the immunization of BCG was given. And from that, the health worker aggregates and puts like how many children has got under 1 year has got full immunization, how many children has got BCG, how many pregnant women came for second visit, or how many pregnant women we followed up in the PNC. So all those things is based on their register. Because there, they record it down. They record their name and then they follow it up whether they're coming. So either it can be a mother card. Yeah, like we also have a mother card. And then the people update it. So in every country, we have that one. Even in Vietnam, in I guess like also in Laos. So we also have the mother card, mother and child card, where they update all the details. So all this time we were dealing with what, when, and where, but not whom. DHS tracker allows you to also record whom. But there have been multiple systems which is focused on name-based collection or granular collection of data. What's the use of DHS tracker? You know, like once you register your name-based registry, like for example, say this particular pregnant woman has got has come from TT1, TT2, DHS will aggregate to your HMIS report. That means in HMIS report, if you have 10 BCG given, then you can link 10 BCG to your names. So these are the different people who have got the BCGs and all. Yeah? But there is also a different kind of information. There is also case-based and other things. Okay? Request for more detailed data, drill down to more case-based. You can say this tracker requires a bit more resources. Huh? Like training your health worker to punch the number, it's fine. But like when we are going for granular data, it's very, very hard. People have to, not very, very hard, but people have to know they should be good in using computers. Hey, entering the names and then connectivity, it's also an issue. So you really need to have that. But when it started, it was just like in 2005. First time we put down the tracker, like the use of collecting the name-based data, because most of the places, they just wanted to have the register, and from the register, we can automatically aggregate the data. So there is no mistakes happen. Sometimes what happened, they put it down in the immunization register, they have service register, and then when they put it into a HMIS report, instead of counting every time, they just used to give a 30, 40, but not really looking at the register and counting. Yeah, so that's why like we started to implement the tracker into it. Yeah. So it's great interest in the tool to support health program, like tracking beneficiaries or individuals or client across the time, across the facility. I guess like in India, like what happened, like for delivery, the pregnant mother goes to their mother place. And then after delivery, she'll come back to her own house, and like that's when like the child immunization and other things will start. So half of the treatment happens at 2 different places. And to track that one, we try to use the tracker. Yeah, I'll tell you how, but like, yeah. Okay? Increased availability of computers and device and connectivity at the health facility. Those are the must, or else it becomes very, very hard. Like for example, you have now, usually what happens, including Laos in other countries, we send the aggregate paper form to the district or to national level, which was the places like, was it Nepal or Bhutan? Where all the data is collected at the national level. No, in Solomon, right? That all the data paper form comes to the national level, and national level it's where you do the data entry by province or by health facilities. So that's fine for aggregate reporting. But like for individual, it becomes more tougher. What we say, the name data should kept at the facility, should not go all the way to the national level and do the data entry. Because all the registers and everything is maintained at the facility, at the hospital, it's fine. But if you have a good interconnectivity, you can like enter that one, not to higher level. It needs need for basic, like say, admission or discharge report from the health facilities. So most of the hospital, if you don't have a software, you can use just the admission and discharge, but not for the whole hospital management system. Don't use tracker for that, because it does not have billing and other things. It's very, very different. So here it's just to maintain one particular record and to follow it across the time period for that particular program. Okay? Now benefit, you can monitor a particular case. You can say like how many people have come to ANC1 but didn't came for other visits. They just came for the delivery. So you can follow it up. You can also say like usually at the delivery, at the health facility level, like we have this outreach activity, right? Usually outreach activity, what happens? The health worker carries all the vaccines to the villages. And then gives the vaccines and all. But like sometimes you don't know how many vaccines I should carry. Do I have to have 10 children or 20 children to vaccine in this particular village? So DHIS can help you on that. DHIS tracker is basically helping the health worker to manage our service delivery in the outreach areas, and also to assess how many stocks she requires, how many people are going to come, who has to need to follow it up. So those things we can try to do it and plan the activities and all. And other great thing is the aggregated data and disaggregated data or granular data are linked together. It's not like if you have entered the whole patient record, DHIS will aggregate and put it in your HMIS report. So you don't have to type it again. And this is what we talk about the integrated system, where once you have entered the data, you don't have to enter it again. This is one common principle we can use even for the donors and all. If a data element is collected in one particular place, we are not going to collect it in any other place. Or else we have to deal with 2 different or 4 different figures. I say even if it is wrong, just report 1 wrong, not 4 rights. Yeah? And improve data quality. But like here, like improve data quality, I like strongly or disagree. The people at a different level, they say, no, if a number is linked to a particular person, then data quality is very good. But that's not always true. It's just a name. You can always create a name. To improve data quality, the supervision. Like you have the different names, you have 10, I guess like every country you have the supervision visits from the, let's say, district office to the health facility. They go around, they check the form, they check like in the villages. Not every month or every quarter they have to go and check the records with what actually has happened. Do you keep that one? This one you can just like have, these are the different facility. Supervision is something, and then collecting this data is very different. It will help you in getting the names, but like not the, it won't directly improve the quality. Quality improves by your supervision and feedback. Now, this particular time, there are 3 types of programs in DHIS. One is case-based, or called a single event without registration. Second is event-based, like for your births and deaths. And third one is tracking a pregnant woman or a child across the health program. Like for example, immunization cycle, or ANC to delivery, or PNC. Okay, so there are 3 types. One is case-based, that means like you just mortality and morbidity data, hospital discharge, where you don't want to record the name of the person, but you just want to record the outcome of it. Yeah, so that one. And then it's a single event, like birth registration, death, maternal death audit. Those things are one-time event. And third one is you want to track one person in multiple places, like TB program, or it can be ANCA and the immunization. Okay, so 3 types. Now we focus on one type, case-based. That means no names. We are just like around case-based. In most of the countries where you don't really have the privacy and other issues, this is very, very good. Yeah, you can calculate all your ICD codes, like which was the form which I was looking at? Nepal, where you have the big form, right? Like with ICD codes and all different kind of age breakup and gender breakup. And it's a big, huge form. And then most of this time, the used form, like very few data will be filled in. And this is also in Bangladesh, also the same thing. And then we have this percentage of filled. That can be easily solved by this case-based. Yeah. So capturing register, like say OPD, IPD details, a specific case event. Aggregation to a higher level, you can have a manual or paper-based aggregation. Yeah. So using ICD code for the OPD and IPD diagnosis is one of the common use of this case space, where you don't really want to record the case, but just the diagnosis, gender, and age. Based on this one, you can calculate all this big morbidity data. Yeah. It's called anonymous. That means because there is no person is involved. And both in Ghana and in Kenya, where is Yonna? Both in Ghana and Kenya are used for inpatient case at district hospitals. Because implementing a hospital information system at the district, it's too costly. It's exactly like running a DHS for a country. It requires same amount of resources, network connected, like all the people have to be trained, maintenance of the hospital server. So what we did, like you can just like have the DHIs, and then you can collect this, the IPD details, or discharge or admission details, and then it's fine. Okay? So we have talked from morning till now. So now it's more about the practice, assignments, and everything. A few basic terminologies what you have to know. So do we know about option set? How many people don't know about option set? Yeah? Okay. Yeah, no, you didn't attend. Yeah, you didn't attend. Okay. So, M, always on the back bench. Transfer one person to the last. Okay, we take the group there. The group number 6. Yeah, that one. So one person to explain about what is option set. Just an example. option set.
Okay. Option set are the options you have for, you can select an option for a specific data element. For example, sex. Your option set will consist of male and female.
Okay. So how is that? Okay, that's good. That's fine. So next question to Knut's group, where Knut is sitting, group number 4. Not Knut, though. Not Knut. Yeah. So now you tell me the difference between option set and category combination. We are just going back, last week. So you have option set and you have category combination, right? So what is the difference? Like what you say, gender? Can it be a category? Can it be an option set? What is the difference?
Yes.
Good. Okay, what is the difference?
In a category combination, you can have you can combine the two categories, like an age category and sex category for one particular data element.
Yes. And option set?
Option set is the different types of options for the category. Like you have the sex as a category, and then a male and female, and you can have another category of age group.
But
and then
option set. Option set
are the different options within the option. Like you can have a disaggregated of sex and disaggregation of age groups. Age group will be a category, and then a set will be, an option will be the different age groups within that age groupings.
Okay, now you're talking about category options. For example, the option set, this is, you really need to understand, we didn't really focus so much, so it is fine. It's a good answer. So, for example, like a person from the WHO said, can we have the option as yes, no, or not applicable? These are different options for one particular data element. So option is something which is in the drop-down list in aggregate, where you can, a data element can have only one option. You can't combine these two. Categories are something which you are entering the data for. So for example, you have, say, John, and the gender is male and female. That's it. And then if you use that one as a category, then you are saying, okay, BCG, male 10, female 20. Okay, category, like when you use category, you are entering the number. Option set, you are not entering any number. Option set, you are just selecting it from the options. Basic difference. Categories, you are entering the number. Categories like age and gender, when we had, you are entering how many are in this particular category. Yeah, like if you have female under 5, and we have malaria case, malaria test, so then you say female under 5, malaria test is 5. Okay? In the options, you just use, okay, like how many, like whom did you treat? What is John is? Male, female? I don't know. So say male. Okay? So you have that one. Or yes, no, not applicable. Those are options for one particular thing. It's just a list of options. You can't combine two categories or anything in option set. Okay? So option set are basically one. Option set can be used for one data element. There is no combination of different things. It's just a drop-down list, just to make things clear. Option set, drop-down. So when you select, you get a drop-down list. That's an option set. Okay? If you want to combine two different things and enter the data, and then you use category combination. In patient level or granular data, option set are basically used. For example, you have an age, say, under 5 or 5, and you don't want people to enter under 5 or 5. You can use that one. Or you say, okay, this person, where does he come from? Does he come from rural area or urban area? That's an option. And you have a delivery. Okay, what type of delivery is happened? Is it a normal? Is it a cesarean section? Those are option. Okay? So anything which is drop-down list is an option set. Yeah? So like when you're collecting individual record or a case-based record, you have options. And this option set, it can also be diagnosis. For example, all your ICD code, a big drop-down list. So you can enter A001, cholera. So then like it can just like come over there. Okay? Option set is nothing but a drop-down list. A big drop-down list. Big, can be small, anything, but like it's an option set. Yes. There was a question, I guess like Nick asked that question. Option set in aggregate data, you can analyze it only if it is a number. If it is text, you can't analyze in aggregate, yeah, in data entry. But in granular or the case of tracker, you can analyze option set anyway. You can like have a filter, you can make an aggregation, you can make a combination, all the things, you can do that. I'll come to that one after the end to show how you can analyze the option set data. Okay? One more there, M?
I just want to clarify. So if it's a drop-down list, the option set is the list itself is called option set, or the name for the.
Like for example, ICD codes, ICD-10, it's an option set, and all the different options below are called options.
Okay, all right.
Yeah,
So
okay.
is this in the list? Is it interchangeable? Sometimes they call metadata.
Sorry? Metadata. It's a part of metadata, but like it is not. Metadata, like it's data element, organate, period, all these things are metadata.
So it's not interchangeable word actually.
It's not
It's not interchangeable. The meaning is not the same.
No, it's not the same. But like it is a small part, that's it. It's just an option, don't worry about that. Metadata is much more, a bit broader. Okay, combo box. Okay, fine. So next terminology, in data element. When we were creating data elements, when we were doing all your assignments, you always type data element type as aggregate. Now we use patient. From now onwards, whole today, we'll use patient. We also use aggregate, but like we'll concentrate on the patient. Okay? In the data element, when you create a data element, we always default type was aggregate. Now we switch to patient. Other terminology is program. We have the data set in aggregate, right? So now we called about program. Program can be like say a mobility program, or a mother and child care program, or a TB program. Now we focus on the programs, on the granular data, like define your own programs. Okay? We don't call it a define your own data set or own form. That's in aggregate. Okay? Clear? Option set, data element type, patient, programs.
I think there is now a possibility to go beyond patients.
Yeah.
Have it as an ambulance.
Yes.
So it's not only patients.
Yeah, but like right now, it is used as patient. 215, we are going to name it, change it. Not now. Fine. Patient is nothing but granular data. And actually, we found a very good name. By Malaysia, people were saying granular. We didn't really understand when they started. So we'll change this patient to granular. It's granular data.
In East Africa, they will never be able to pronounce it. Granular.
Even in Vietnam, they're not going to pronounce it, but yeah. But like then, like you can have a different name, Vietnamese name, so it's fine. Or in EAC too, Swahili name. And then now we are only focusing on this one, at least for next half an hour or 15 minutes, half an hour. Single event without registration. That means you're just creating a program. You're not doing anything with the person name or at all. We are just collecting like case-based. Like for example, let's say mobility details, ICD code, age, gender, that's it. No names associated. You can also include, say, patient, the hospital patient number. Because, and then hospital patient number is very, very unique for that particular hospital. And if you want to, no one in the higher above will know about that one. They have to go to that particular hospital to find out who is this HA001. Because every hospital, most of the hospitals have their own code. So they're right there in the book. Like for example, in Zanzibar, they have each folder, each patient has a folder, brown, and then they put all the patient information, and they leave it in a room. So the whole HMIS room is filled with all this paper folder. And then you have to go 2 rooms past inside, and then you see one person sitting over there. Yeah. So this is what we can use for. You can take the hospital patient code of a person, and you can include here. It's fine. This person, what is the use? You can't track him. You can't link from one place to other places. This program you can't track. It's only one time. If you want to track, then it is a different program. This program we can't track, just one shot, and without having any details with the person. Okay, and other thing what you have to know is program stage. You have a program, let's say, any other example, mobility or yeah, mobility data, and then like you have only one thing, like how many people have come, admission, hospital discharge report, for example, program, where a hospital discharge is your program, and you have only one stage, without having anything to do with anything with the person. Okay? Yeah, just to go through the model. Options are linked to one data element. There are multiple data elements can link to one program stage, and especially in this case base, one program stage is linked to a program. Okay, and there is no person involved. Fine? Confusing? Yes. Program is health program. What you want to monitor, like admission report or discharge report or things, where you don't really want to take care of the person at all. You just want to get the diagnosis detail or your top 10 diseases, for example. And then you don't know what are the different top 10 diseases, so you add all your disease list. Then like you can add your age and gender here, and then you try to get these things. It will be a bit more clear when we go to the application. So I've added this step-by-step guide in every program, just to know where to start. First thing is choose a case-based program. So every group has a health person. So you can choose your own case-based program. Identify what should be in the option. Yeah. First, always identify what should be in your office, whether it is diagnosis, whether it is like male, female, or whether it is rural, urban, mode of discharge, delivery type. So if you choose, say, I just want to record delivery in my hospital, just the type of delivery and discharge. So you just say delivery type, normal or cesarean section, discharge date. So you can just have those things, okay? Without having personal information linked to it. And then you create data element with type patient, include the option set in relevant data element, create a program called single event without registration, and then include the data element into that program stage. Here, assign the program to a particular org unit, just like what we do in a data set. When we create a form, we assign the form to a particular hospital to be collected, right? A particular health center. Similar way, you can create a program and allocate that one. If you have, say, inpatient as a program, you don't have to allocate to all the health center who does not even have any inpatient program. Yeah, that's why you have this. Yeah, so these are common. This we already know. We assign a data set to your org unit. We assign a program to org unit, that we know. This one, program to user role. This is a new thing which has been added in the program or in the patient voice. Because since it's a patient level or granular data, we want only few people who has the role to access it, not everyone. For example, if you have a, say, TB patient or other things, you just want TB people to record the program. Okay? So this is fine. Here it is the one thing. Okay? Let me just go to the application itself. Yeah. Yes. Yeah. Yes. So like if you can also have ANC program, but then you are tracking an individual mother over a period of time. That's your third program. Now we are talking about very specific. Let's just say, like in Vietnam, they had something called delivery report, where they don't really track the mother. They just want to say in the hospital when was delivery done and what was the mode of delivery. So you can use the case base just to collect that one, where there is no information about the personal health. And if you want to track one particular person across over the period of time, then you use the third program, which I'll come back later. Yeah, so there are various different kind of programs. For example, single event birth registration. That's also a program. Death registration. Yeah, so you have a different program. But in birth registration, death registration, you record a person, not without the person. Okay? Yeah. So we say event, case event, activity, or yeah. Now one other things. Okay, and this whole tracker module, it's still under development. It's been used, it's also implemented, but it's also like constantly there's been changing, lots of things are adding on. Because it's a huge task. So if you find anything, just also say, like for example, names. We've been had 3 workshops just focusing on what should we call it. And we said, okay, this one it is. Yeah. So can everyone see the screen? So, like we design our data elements and the indicator is all in the maintenance part, even creating a program is also in maintenance part. Okay? We go for maintenance, and we see here maintenance, persons and program. We click on it. Yeah, I have to log in. Okay. Person and program, and this is where you create a particular program. Yeah, but what did I say in the presentation? The first step is to select what we want to create. So let's say, what do you want to create? Let's take about, like, say, disease profile. So, author, any good suggestion? You've been listening? I'm just saying for case base. Case base. Tracking? It's the new okay, outbreak, for example. Yeah, we want to create a program called Outbreak where we want to have a list of diseases. Okay, dengue outbreak, and like then you have an outbreak, say dengue, malaria, or no, dengue, diarrhea, and number of people, and age. Okay. It's always good to plan before we do what we have to do. So, outbreak events, recording, outbreak events, for example. Okay? So we are creating a program called Outbreak Events. And then what all the different data element to collect is disease. And we have, say, diarrhea. Yeah. And then dengue. Any other? Sorry? Sorry? Polio. Okay. And then we say, the next thing what I want to check with this one is gender. Male. Female. Okay. And gender. And then age. Location. Okay? It's fine? One more time. Type of discharge. No, because this is outbreak event from outside the facility, right? So we are not really looking at the inside the facility. Not over the few months. What you can say, date of registration? Date of registration or reported? That's then like you can just say outcome. Yeah. Dead, alive, alive is cure or hanging. 50-50, not dead, not alive. Okay. Yeah, fine. It's okay? So we have a program called Outbreak Event. We have a date. It's all case-based, huh? So we have a date when it was reported. We select the disease. These are the three. We have a gender. We have an age. We have rural-urban location. And we have outcome, death and alive. This is the program what we want to create. Here, there is nothing to do with the person. Yeah?
Could you put there, for example, if you've got 12 districts, could district 1, 2, 3, 4, 5, 6, would that be better? No? Just rural urban.
Rural urban. I'll tell you why. You have to sit down and listen now. Yeah. Okay? So here, this is just reported cases. Fine? So now what I do, what was in the presentation. The second step was is to identify and create option set. So what are the different option set I have? I have disease as one option set, gender as second option set, location as third option set, and outcome as fourth option set. Okay? So first, okay, now I identified all these option set, now I have to create it. So how do I create? I have to go to my DHIS, maintenance. Okay, any kind of creation, it's always in the maintenance. Okay? We go for maintenance, and this is the one thing we've been like breaking our head to not to put in option set in administration. You have to go for maintenance and data administration, and there you find option set. How many people agree this is the right place to have option set? You agree? You people. So option set, you go for maintenance, data administration, and click on option set. So there are lots of different option sets on here. We can search whether we have a gender as an option set. Yes, we have it. I click and I say edit. Okay. But like this is different, not applicable. Okay. So not available, not applicable. I don't know. Now I'll create, no, this is not the options which I want. So I'll create a new, add new. I say gender for outbreak. And options are male, add, female, and add. Okay? You can also like go up and down to do these things. Okay, added. So I created an option set called gender, outbreak, and I added all these things. I take add new, and I say, this is outbreak, and options are diarrhea. I'm very bad with the spellings. Polio. And what was that again? Measles. Dengue, malaria. Okay, fine. So now what I am creating is an option called the disease outbreak, and I'm adding all my disease which I want to collect. That's it. Add. Done. So what else option set? Age option set? No. So it was no age option set. And then it was a location. Add new location. Here I go. Okay. So add, and then outcome of outbreak. Here, alive, that. Add. Okay, remember, we are not collecting the numbers now. We are collecting just a case. Main thing you have to always think about that. When we are doing this patient-wise, we are always collecting a case. Now, okay, what next step? Next step is to create the data element with domain type patient. We have just created the option, but like we haven't created any data element. Okay, like your category combination, We create a data element, then assign the category combination to the data element, right? Similarly, we have to do that one here. So now I go for, so where do I create data element? In services. So we go for maintenance, data element and indicator. We click on a data element, and we say add new. And then we create outbreak. Okay, short name, code if you want to give. And here, the domain type, we change it to patient. Value type, what? Text. Because all the options in here are text. And then here we have option set. We don't go for category combination, but we go for option set. If you see, when you select a patient, you can't see category combination is blocked. You can't select anything. For patient level or granular data, it's just only option set is available, not category combination. Okay? So now I select the option set, disease outbreak. That's it. And I say add. Okay, what is legend set? Author is asking a question. Very good. So which group will answer? Okay. M? Legend set are used for the GIS. Okay, so now I'll take one more, add new. It was gender. Again, patient, value type text, option set, gender outbreak, add new. It was age, patient type, domain type patient. So what should be the value type? Number, text, text, that? No, value type, value type. It's number, because they enter the age. You can ask date of birth, but you can also ask age, yeah? And then here you can say outbreak age in years. Okay? So as author suggested, it has to be descriptive. So age, it can be 2.3 or 2 months or 4 months, or so it's always better you specify, is it in years or is it in months or is it in days or. Sorry? Which one? It depends. You know, like sometimes you always have a, like if I ask my grandmother, what's your date of birth? Date of birth? No. What's your age? 55. So that's what like they say. Like, so it's fine, based on what you want to collect. So here you're just collecting the case. So it's always better by years. We don't want more complicated things. Yes. Yes, yes, it can. But like, depending on what you want to see, what you want to collect, okay? So you can always have date of birth, okay? So now it's fine? You can't hear me now? The question, okay. Sorry, the question was, can we have date of birth instead of age? Yeah, I said like, yes, you can have date of birth also. And system can calculate the age automatically. But based on like the experience what we have, most people don't really remember the age or date of birth. For example, old generation, you ask, for example, Yon, what's your date of birth? What's your age? Yeah. It's very easy. Because then you can always say, I'm just still 20. And if you ask, what is your date of birth, then he has to calculate it, so it's hard. Okay? So depending on what you want to do, you can collect that one. Outbreak, age in years, and we leave this one as number. We don't select anything option set, because we just want them to enter their age, and we say add. Okay? So let's see. So I added gender, location. Okay. Outbreak. Location. Value type. Good. And then option set. It's outbreak location. Add. And then one more. It was outcome. Domain type patient. I didn't select it. Oh, okay. My mistake. Text. And then option set. It was outcome, right? Where is outcome now? Outcome outbreak. Okay. Add. And for the previous one was location. Edit. Domain type patient. So, okay. So we have these 5 things. It's fine. Anything else missing? Age, disease, gender, location, outcome. Done? Just like normal as we create the data element, but like we just select domain type patient. Now what I do, I created an option set. I created the data element. I included the option set inside the data element. Now I want to create a program or event. I go for maintenance. I go for data set. We go for programs, persons and programs. We click on maintenance, persons and program. I click on program. I click on add new. And here I say outbreak events. Events with outbreak. Okay, and the type. So we have given very good type of the description. And this is we decided in Oslo University when we were having a tracker academy or a discussion with various different people. We didn't come up with a name, so we just like gave like this. Single event without registration. That means it's a single event. We don't register any person. That is called single event without registration. That's what we are doing now, the case base. Single event without registering the person. And then we have single event with registration. And then we have multiple events with registration. For creating this one, we select single event without registration. And then you see all the options which were below closed down. So we don't have to worry about that. Okay, we'll worry in the next 1 hour or so. Okay? So we give a name, description, a type, single event without registration. Don't worry about this one. And then here, don't worry, allow enrollment in all org units. All org units in my country are supposed to register outbreak. But I say no. But not all. I'll select who has to register it. Okay? Just for fun. Outbreak, description, select the program, and add. Okay? So what do we have to do next? We did this one, we did this one, we did this one, we did this one, but we didn't do this one. Right? We created the program called Outbreak with single event without registration, but we haven't included any data element into the program yet, or program stage. How do we do that? We go here, and which is the program we created here? Outbreak events. I click on Outbreak events, and you see View program stage. Only program stage can have a data element, not a program. Just a program stage. And then when we talk about the third one, I'll tell you about different type of program stages. Okay? So I go for View program stage. DHIS is already created the name, so you don't have to worry. You just have to click and say Edit. Don't worry about all these things. This one I'll tell you later. If you want to capture coordinates of the outbreaks, you can also do that. And then in the GIS map, you can see which is the places where we got the outbreaks from. Yeah, I guess this is not yet implemented in DHIS. It is, okay, it is new. 2.14. Yes, but like to show it on GIS. Okay. 214. Good. So this one, we can capture the coordinates. If people, like say, some of the donors wants to capture the coordinates where actually the outbreak happened, you can capture longitude, and you can get that one. And then this will be shown in the GIS map. Okay? So for now, I just say no. And then I want to add all my data element which I have created. We created all the data element with outbreak. So I'll click here, filter, then you have this one. The first thing, outbreak location, disease, then gender, then age, then location, then outcome. This is how I want my screen to look like. Okay? If you want to move up and below, so you can always move around in this place. Okay? There are a few things what you see here. Compulsory, that means a person, when you're registering, have to fill this data. Like for example, we say age or gender. He has to fill in age and gender. He can't just leave it blank. Diagnosis or the disease, he has to fill it in. He can't leave it blank. So you can make different things as say, compulsory. Provided elsewhere, don't worry about this one now. I'll tell you about it later stage. Display in the report. Yeah, we want to display it in the report. And then, if we have, we forgot date of registration. But like that's fine. If you have a date field, then you can have it future date if you want. But these are the different options what we have. But we don't have to worry that one. We just like put all the data elements in here. Okay? And here, this is a description of reported date. That's a date of outbreak recorded. Okay? And then update. Fine? So let me go back to my presentation. I did this. I identified the option set. I created the data element. I created a program. Then I created the data element and included that into program stage. But now I want to say which health facilities are collecting this program or the events. Okay? So I'll go around here, go back. So this is my program, outbreak event. I click on outbreak event. Like you assign your data set to an org unit, the same way. Assign program to org unit. Click on it. and I say this health center or all the PHCs or level 4 need to report this one. That's why, like this is what I did. Huh? Selected the program and assigned that one to health centers. And I say update, now save. Then there was one more thing which I was supposed to do. Who should enter this? Which user role? For example, I say only super user or M&E officer can record this one, or health worker can record this one. So you can assign a particular role to who can do this one. For now, what I do is to assign program to user role, and I say super user should collect this one. If you create a TB program, and then you can assign only TB person should be able to collect this one and record this one, not anyone else. Yeah? So you can do those things. Right now I just say super user should collect this one. And I say okay, it's done. That's it. That's all we have. All these things. Now, just to look how I feel, what I did, I finished with the maintenance part. Now I have done with the maintenance. Now I have to record it. And facility has to record it. So a facility person logs in, he goes to services. This one is services. Under services, you have called individual records, which will change the name soon, because this is not really individual, but the case. I click on individual record, and there is something called single event without registration. Yeah? There is a single event without registration. This is data entry, basically. Single event without registration. So I click here. And then I select my org unit of facility which is reporting all these outbreaks. And that's why like you have these things. We don't really want to put the district names. You can also have it here. You can also have a location as your drop-down list. But like not to make it complicated, I just like put it out here. Okay? I select a health center and select a program, say outbreak event. I click on Add New. You see here, this is the description which I gave. Date of outbreak recorded. I select the date. Say February 1st was when I recorded my outbreak. And here is the all our diseases. Let's say polio. The gender is male. Age 45, location rural urban, outcome alive death. Okay? You can create this one. Fine, and then you can say complete and add new. Okay? And in the same date you can record multiple things, so you don't have to worry about changing the dates. If you want to change the date, you can also change the date, but like that's default. Because most of the time you get it in that particular dates, and then you have to record all your outbreaks events. Okay? It's clear? Yeah? One more quick thing. Let me try to go back to the program. I created a similar kind of program here. Inpatient mobility and mortality details. Yeah. You got the individual record, single event without registration. Instead of selecting outbreak event, I just select the one program which I already created before. And say add new. And this is date of discharge. Click around here. I have age, gender, admission. And this is list of all the ICD codes. So we already have created an option set called diagnosis ICD code. You can create a data element and you can use the same ICD code for your things, okay? And here, I can either say cholera, or I can just say A001 or something. So you get that one. Or let's say, so you have diarrhea with blah, blah, blah. So you have diarrhea here. Yeah, you can search. So these are all the ICD codes which we just like uploaded. So you have it.
So that's inside DHIS now, all those 60,000.
ICD codes. So if I go for maintenance, data element and administration, go for option set. I select for, here it is, diagnosis ICD code. I click on it, edit. You have list, all the list here. Until Z9999. All the 40,000 ICD codes, you have it here. And if you want, if you have different ICD code, ICD9 or things, if you have the list, we can also populate here. Like we did this one by like a small query, put it in. Or you can type it in if you have lots of time. Okay? But if you have the list, we can easily populate it up. No problem. Okay? Fine. For your assignments, you have to use this option set and include it. So don't worry about creating all these 10,000 IC things. The useful of this one, like it's when we're implementing in Kenya. Sorry. Not here. So you have the list of all the ICD codes around here. You have mode of discharge, gender, and all things. By this, you can generate the Nepal big form automatically. So we don't have to worry. Same thing has been used in Tajikistan, same thing are used in various places. So people feel happy because they just have to enter only 3 things. Yeah, just the ICD code, age, and gender. And based off that one, like all your big forms can be calculated. And then you can always have top 10 diseases. That's why we collect this one, right? So top 10 diseases in my country. And we can just focus on those top 10 diseases. And how to get top 10 diseases, we'll come back to that one a bit later. Fine? Clear? Okay? Data element to your program stage. Okay. So for that, we go for maintenance, program. You have program here. You click on the program. And then since it's a single event, I click on outbreak event and view program stage. Because data element can be assigned only to the program stage, not to the program. Okay? And we click on view program stage. And then we say, one more time, edit. And this is where you assign your data element to your program or program stages. Okay? So what we do, we go for program, we go for a program stage, and we edit a program stage and include all the data elements what we want to include in the program stage. For example, here I want to include ICD code diagnosis. Just like include it. Update. When I go for services, individual record, single event without registration, I select outbreak events, add new. Let's say 7th. And here I already have ICD code listed. So, okay.
There you have the disease, will be polio, and the diagnosis, the ICD-10
Yes.
will be polio 1, 2, 3, 4.
Yeah, something. Like for example here, polio, and here, Yeah, 80. This one? No, we don't really allow multiple ICD yet, but like soon. But like, we can always have diagnosis 1, diagnosis 2, diagnosis 3, diagnosis 4. It's fine. Yeah, Butika?
Like what we did in data sets, we created sections and HTML forms. Can we do it here, sir?
You can also create forms for the programs. I'm not going to too much in that detail. You can create forms, everything. It's okay. Like to show you, go for maintenance, program. View program stage. Design data entry screen. So we can try to do that. Okay? Fine? Any questions, any doubt? So now let's look at your assignments. Ments. Okay. So log on to your place, the Moodle, and here. Where did the assignment go now? No assignments? Assignment is lunch? No. Already created assignments, and it was a beautiful assignments. Okay, I'll upload it. Okay. Very simple. Let me just also update it in Moodle. Okay, let me just explain and then I can upload it. Okay, so what you have to do, very simple, create a case-based program and also use the presentation because there you have step-by-step things. I've already taken the liberty and given you the data elements. You're going to create a single event without registration and use the option set as diagnosis ICD-10 for creating this form. Mode of discharge. Alive, dead, transferred, transferred to higher facilities. No, but like this is with the people. Every group has a health person. Every group has a health person, so they can say what is the mode of discharge should be in their option. Mode of discharge by ambulance, discharge to the bar, referral, and also like it's, yeah, just left without informing. Okay? So, yes. So you use this thing. We are just making this assignment. You create all the things. Make sure you create it using your group name, especially group number 8. Who is group number 8? Yeah. We had a tough time to find some of your assignments in the DHIS. So please use your group 8 or team 8. It's fine, anything. But like just like use G8, it's also fine. But use something. Okay, and then after you do, create everything, take a screenshot of your DHIS instance and upload in the Moodle. Okay? Fine? Clear with assignments? Very few, very easy. Yeah, I'm not telling you to make validation rules or data entry screen or anything, you just enter.